This is RegisteredNurseRN.com, and today we're going to talk about varicose veins. Now, if you're a nurse, then you're probably going to be standing or walking on a hard surface for long periods of time throughout the day, and because of that, you're going to be at a little bit higher risk for developing varicose veins and spider veins as you age and as you go through your career. So, first of all, we're just going to talk a little bit about varicose veins and spider veins. Varicose veins are those really large rope-like veins that appear on the legs, typically of older people. They have a tendency to look like really large twisted pieces of tube or rope. They result from sedentary lifestyles, although heredity and genetics can also play a very large role in them. And what happens is that these valves in the vein become damaged over time, and blood begins to pool in the veins, and this results in the veins becoming larger and larger over time, until you have that appearance of that rope or tube-like large veins running through your legs. And spider veins, those are the smaller veins. They tend to have like a bluish or purplish color, and they're little small streaks of veins. They also result from blood pooling and leaking around the vein, and trauma can also cause those. A lot of people are self-conscious about these types of veins that can form on your leg over time, and like I said, in nursing or any healthcare profession or any profession where you're standing for long periods of time, you can put yourself a little bit more at risk for developing them. And so we're going to give you some tips on how you can prevent those from forming. The first thing you want to do is to exercise your legs frequently. And as a nurse, that probably doesn't sound like a great idea. You're usually on your feet for long periods of time already, and you come home, you may have leg pain. But if you exercise your legs regularly and keep them toned, keep them in shape, then you're going to build up that vascular system in your legs. You're going to be in much better shape, and this is going to keep your vascular system running at tip-top shape, and you're going to prevent some of that vein and blood pooling, as we talked about earlier. And again, I know that walking around all day seems like that's exercise. That's really not exercise. You want to do something. You want to ride an exercise bike. Maybe if you can do some squats at home with a small weight, or some calf raises. You can do those on a stair step with a little bit of weight. And those little simple exercises like that will help you keep your legs in shape. The second tip we're going to give you is to wear compression tights or compression hoses. And these are sort of like small pantyhoses that come up usually to about your knee or thighs. And they have a special net compression material. One popular brand is called the Ted hose, and there's many brands out there. The important thing is that you're just looking for compression tights here. What that's going to do is that's going to keep your skin really tight while you work as a nurse, and it helps prevent the blood from pooling and collecting down at your legs. And nurses they love these things. I know that my wife's mother wore these. My wife wears these. A lot of women in nursing wear these, and we also have these in our store on our website. You can shop around. They're fairly inexpensive. You can usually get, maybe 2 to 3 pairs for around $20 or sometimes less, and they tend to last a long time. They're washable, so if you don't have compression hose, I would definitely recommend you buy a pair of those. You can also massage your legs regularly, especially after a long shift. If you can just kind of sit down on a massaging pad or have someone massage your legs just to kind of get the muscles relaxed, get the blood flowing. Another tip is just to maintain a healthy weight, and you can do that by eating a balanced diet and again exercising regularly. And when you keep your weight at an optimal level, you will help prevent some of those varicose veins from forming. Another thing is just to take breaks and stretch while you're on the job. And I know that can be hard sometimes. Nursing's very hectic, especially depending on what specialty you have. But take a few minutes and just stretch out your legs. Maybe do a few exercises at work just to help the blood circulate well in your legs, and that will help a little bit as well. And the final tip we have here is just to get some really, really comfortable shoes. We made a video, and we also have an article on our website about the best shoes for nurses. And it's just really important to get a good pair of shoes with a good insert that are really comfortable. That's going to help your feet. It's going to help your circulation. You're just going to feel a lot better. And, once you get the varicose veins, is there any way to get rid of them? Well, the best medicine is always prevention, right? So you want to do those things we mentioned before to help prevent those from forming as much as possible. And if they've already formed, you can get an injection, especially for some of those spider veins. They do have a technique that they can remove spider veins. Surgery's possible for some vein types, but again, it's probably not a great idea. It's not something I would personally do, but injection, surgery, that's some options. Some people are really self-conscious about it, like I said, but just try to do the best you can with preventing it. Okay, so in conclusion, varicose veins are a problem in nursing or any profession where you stand on your feet for a long period of time. Definitely take those steps. Exercise, wear compression tights, massage your legs, stretch, maintain a healthy weight, get some really comfortable shoes. And if you do those things, that'll help a lot. And again, this is registerednursern.com. If you haven't stopped by our website, make sure to stop by, bookmark our website, and check back from time to time. We have a lot of great tips and articles and information on there. We also have a nursing store where you can go and shop for different supplies on there. And you can also subscribe to our YouTube video. We'll be putting out a lot more informational videos with some great tips. Thanks for watching.